Here are the guidelines for when to prescribe statins for the prevention of atherosclerotic cardiovascular disease. We're going to talk about secondary prevention and then primary prevention. Secondary prevention is in patients who already have atherosclerotic cardiovascular disease, so that includes heart attacks, angina, CABG history, strokes, TIAs, peripheral artery disease. In these populations, if they're less than 75 years old, they automatically get a high-intensity statin, and if they're greater than 75 years old, they automatically get a moderate-intensity statin. Next, primary prevention for people who don't already have one of these conditions, so this is kind of the general population with risk factors. If your LDL is 190 or greater, you automatically get a high-intensity statin. If your age is 40 or more and you have diabetes, could be type 1 or type 2, and your ASCVD risk score as calculated with those online calculators is 20% or more, then you get a high-intensity statin. If you're 40 or more with diabetes and your ASCVD risk score is less than 20, you get a moderate-intensity statin. Lastly, regardless of your age and regardless of your diabetes status, if you have an ASCVD risk score of at least 7.5%, you can get either a moderate or high-intensity statin. Lastly, one note, the high-intensity statins are considered atorvastatin at 40 or 80 milligrams or rosuvastatin at 20 or 40 milligrams. All other statins are considered moderate or low intensity.